Well, thank you everyone for coming and watching. My name is Julie. I'm Chief Marketing Officer at contextflow. Probably don't need to tell any of you, but the chest is really complicated. That's because it's really difficult to accurately determine the amount and the distribution of complex disease patterns. They tend to overlap or run into each other, and that makes really consistent objective measurement of changes over time impossible for even the very best of radiologists. And then there's everyone's favorite task of nodule detection, right? So you have to detect, measure, you have to follow various reporting guidelines, and radiologists tell us that that's really time-consuming, kind of stressful, and really not interesting or fun from a clinical perspective. So it's clear that we need to provide better support when it comes to the chest, and that's exactly why contextflow has developed advanced chest CT. This is a computer-aided detection system. It's designed to help save time and improve reporting quality for lung cancer, interstitial lung disease, and COPD patients consistently and objectively over time. So our indications for use, as I mentioned, chest CT, those are the three main use cases, and we provide detection, visualization, quantification, characterization also for nodules, and disease patterns. So when you first enter the workflow, we're already telling you about the presence or absence of nodules, as well as how many you can find, providing you an overview of measurements and location. Maybe that helps if you only have a few minutes before your next meeting and you want to pick a case that you know that you can work through quickly. Once you've entered the workflow, so here we have shown you your current patient on the left, contextflow's results on the right. The scrolling is synchronized. We're providing you the necessary measurements that you need to follow your reporting guidelines. So this is clearly for nodule detection. And this is here our insights. So these are disease patterns that we have highlighted in color. Again, that scrolling is synchronized to help you come to your reporting analysis a little bit faster. And we can prepare our results in the form of DICOM objects to be sent to your structured reporting module or as a PDF. Now, everything that I showed before was directly within the workflow. If you would like to explore a little bit more, you can click with one button into our UI. So this here is our insight screen. It consists of two parts. On the upper part of the screen, this is our disease pattern detection, visualization, and quantification section. Right now, we look for 7 key patterns, including like emphysema or consolidation, pneumothorax. Everything is highlighted in color, so you can scroll through the volume and see where we have indicated anomalies. And on the lower half of the screen, this is obviously for nodules. So again, detection, quantification, visualization, characterization, and you can also here select the appropriate guideline that you need for your reporting so that things will be prepared in the way that you need for them. Now, something new that we have for RSNA, I'm very happy to introduce, is a malignancy score from our partner RevealDX. You can actually visit them over there as well. A malignancy score, the idea is that these nodules, we're taking the nodules that you're looking at and comparing them with thousands of nodules with a known outcome. And when you do that, the majority of nodules tend to fall in 2 categories. It's pretty easy. Most of the distribution is going to be either clearly benign or clearly malignant. And that way, hopefully, we can free up a little bit of time for you to focus on the nodules that actually need your expert review. So this you can read about in a clinical study published in the Journal of the American College of Radiology from September of last year. This here, following along with the nodule detection theme, is our timeline screen. So this is where we're following nodules over time. Each row represents a different nodule. And then we have heat maps to show you volume doubling time. So the more red one of those graphs becomes, the faster the time to double, and the more green, the faster the time to half. We're indicating the overall volume of the lung affected by nodules. And we think that radiologists tell us this is saving them time when it comes to preparing for follow-ups or MDT meetings, because again, they can just very easily see if their treatment plan is working. And last but not least, this is our search feature. This was the very original feature that contextflow developed, as we're specialists in ILD patterns. So here we enable you to compare and contrast your current patient with thousands of others from a knowledge base that we developed. So that's all these reference patients here in the center. That kind of transparency actually really helps people understand how our AI is working. So you can click through, see, okay, I see differential diagnosis recommendations from contextflow based on the reports of those reference patients. We link you to medical literature, either StatDX or Radiopedia, so you don't have to log into your own StatDX account anymore if you have the integration. So we try to really put everything in one place very simply that you would need for anything that has to do with the chest. As I mentioned, any of our quantifications and findings can be provided in the form of a structured reporting, basically modules to be fed into your structured report or available as a PDF. Why is the malignancy scoring important? As I mentioned before, clinical impact. Well, in 30% of CTs, we're going to find at least one nodule, and the management of those nodules can often cost up to 10 times the cost of the CT itself. So we know we're talking time, we're talking money, we're talking a lot of stress for the patient. And so when you use a malignancy score, if you read that study, which I have copies, so if anyone really wants to read it, I can hand you a copy. You find that lung cancer can be detected in 45% of cases up to 1 year sooner, while still significantly reducing false positives and false negatives. So we really think if we can implement that at scale, we would be doing a lot to save unnecessary procedures and patient stress. Validating our search feature that I showed. So this was performed at the Medical University of Vienna, and there we noted an overall reporting time savings of 31% when the search feature was available for use. And that was true for both the more junior and even the more senior of radiologists. We also noted a trend towards improved diagnostic accuracy, again, when search was available for use, because they didn't have to spend so much time looking for information, and we provide them those differential diagnosis suggestions. And because we try to provide really comprehensive support for lung CT, we're very happy to announce our partnership with Avicenna at RSNA. So early in 2024, we're implementing the incidental pulmonary embolism algorithm. So you can look for that shortly. Also have some other new features coming in 2024. I can't yet quite say, but please come and visit us at ECR if you come to that event. And yeah, of course, you can follow us on LinkedIn, Twitter, contextflow.com. Again, my name is Julie with contextflow. Thank you to our host, Blackford. And we help radiologists to see beyond just a single case. So thank you for your attention. Let me know if you have any questions or if you'd like a copy of any studies.